Thank you so much. So hello, everybody, and welcome to the third day of our summit. We're really excited to have you here with us. And I have to say that I've thoroughly enjoyed the past 2 days. The first day really talking about where we are on this journey of strengthening the IHCC. And the second day then talking about emerging data and industry perspectives and how we can improve our longitudinal cohorts. Some of those discussions were so helpful and will really help us enrich the cohorts that we work with. But today, day 3, is a very special day because today we're going to talk about the challenges, the best practices, and about the lessons learned by low middle income countries or in low resource settings. And as you're all aware, the IHCC has really put an emphasis on ensuring that cohorts from less resourced areas of the world can be included and must be included because we need to cover the entire global diversity when we think about cohorts and we think about health and improving health for people in the world. So, so today we're going to, first of all, have a keynote, which I'm very much looking forward to, and that will be followed by some African studies looking at the African Population Cohorts Consortium in its formative phase, but also the African CDC Pathogen Genomics Initiative. And after the break, we'll then go into a panel discussion and then have some more information on data and cohorts in these sort of low resource settings. So very excited about both the discussions and the presentations, and just to encourage everybody on the platform to please talk to one another, use everything that is available there because it gives you an opportunity to link with people and to start conversations, or at least, sort of say hello and let's connect again after this summit. So without further ado, it is my great pleasure to welcome our keynote speaker today. So Professor Sanjay Jivakar is head of the Vadu Rural Health Program, Hem Hospital Research Center in Pune in India. So he is an anthropologist, a researcher, a mentor, and a teacher with more than 30 years of experience in community health research. He was the founding principal investigator of the in-depth data management systems, and he established the Indian Health and Demographic Systems Network, which I'm sure we will hear more about. So he leads multidisciplinary teams that perform research on demographic surveillance systems, childhood migration, tuberculosis, adult health, SARS-CoV-2 infection trends, the human microbiome and excess mortality, as well as vaccine trials. So community engagement and community participation in health-related research study is at the heart of his work in rural India. And as part of that work, he provides guidance and mentorship to national and international master's, PhD, and postdoctoral scholars. So Sanjay, we thank you for sharing your thoughts and your experiences with us at this International Cohorts Summit. Over to you.
Thank you very much, Michelle. Thanks, Amanda, and thanks everyone, all organizers, for having me here. Amanda, may I request you to put on my slides? Thank you very much. Great. So low resource setting cohorts. There are cohorts everywhere in the high resource setting, low resource setting. Is there anything that we from the low resource setting we could offer to the global health? I believe yes. Can I head to the next slide, Amanda? Amanda, yes, great. And what do we learn? What do we give? We know that global health cannot be real unless it is really, really global. What do you mean by it is really global? Just take the example of SDG 3, the good health and well-being. I think if it has to be addressed, if it has to be achieved, it will happen if and only if the LMICs and the LICs achieve the goal, which itself says that it cannot be real unless it is really global. Can we go to the next slide? In the next 20 minutes or so, I'm just going to talk to you about a little different. I'm not going to talk any specific cohort per se, but I'll give you a few examples. But the value of networking, the challenges the cohorts encounter, or in LMICs and LICs, and a few lessons learned. There are 7 lessons which I feel we could learn from the LMIC cohorts or the low resource setting cohorts. Next slide, please. This map, many of you might have used this, seen this at many presentations, at many different references. But look at these low resource setting. Why this map is like that? Are there any cohorts which have been studying this area? There are. So there are cohorts here, there are cohorts in the north. So what is the difference? There is cohort. You know, look at some of the cohorts. These are names. Don't try to have any meaning into that. At this moment, we have New Delhi cohorts, Pune cohorts, and then many of these cohorts in the LMICs are the F4S cohort in Southeast Asia, cohort in Uganda, then longitudinal cohort in Bangladesh. This is what it is. Can we go to the next slide and see what happens in the high-income countries? Look at that. So this is just the difference. What is the difference? We have the cohorts here in HIZ, which each cohort has a clear name. It has a recognition. It has a recognition by the name as well as a logo. But what difference does it make? What do we really learn from this? Next slide, please. This is the first learning. What is more important for any cohort is a branding, a visibility. You have seen the cohorts, the 2 slides, the visibility. Simply naming the cohort appropriately, organizing these cohorts well, and branding these well. It helps to generate resources, generate data, generate attractions from the collaborators across the globe, as well as the funders, which are the main contributors to generating or maintaining good cohorts. Publications by cohort names. There are n number of cohorts, but you will see that these branded cohorts will have their names on every publication. Does that happen in the smaller cohorts in country level? No, because the value is more given to the institutions which run the cohorts or to which the researchers belong to. I think that is something which I mean when I say organized cohorts. Can we go to the next slide? Second learning from this, solidarity is important. If every cohort is together, you see the cohorts in the high-income countries, they talk. There is a crosstalk between each other. Is that enough in the LMICs? I think we are a little far away from that, and there is a lot to learn from the West. So we need to do that. Networking is something absolutely crucial. I'm going to talk a lot on networking in the next 10 minutes or so. It keeps the science updated because we work together, we learn from each other. Evidence generated is multifold because it is pooled together. It keeps funders interested because they don't have to invest too much of time in assessing every small cohort. They work together as a network, with a network, and that their life becomes easy. Keeps collaborators interested because there is a lot of learning from pool cohort. There is a lot of learning when people come together, when there is solidarity as a network. And because we know that we have to be with each other, the data quality in turn improves. The visibility for all these things is extremely important, and visibility is to a focus to the end goal. And that is what I mean with this picture in front of you. Next slide, please, Amanda. Amanda, next slide, please. Thank you very much. This is just an example which Michelle mentioned. A recently formed network of Indian HDSS sites. It's following a population of 1.5 million. Is that a small if you have a cohort of such things? This 1.5 million HDSS becomes a cohort if and only if all these sites come together as a network in uniform. There are sites from private sector, there are sites from government sector. There are sites who have collected minimal data set from all sites are collected everywhere. So can't we have these sites as cohort? Can't we have big cohorts formed within this network? what we call the nested course. I think that is possible. Next slide, please. Next slide, great. So what is the benefit of networking? Look at this. We have data quality, mutual experiences, collaborative research, common resources, translation to policy. All these things to achieve good data sharing, responsible data sharing, enhanced training on capacity building of the network partners, collective evidence for the network level, and it's not just focused around your own small area where you work. Ease to solicit funding is also there, because then you all with together approach a funder. That becomes easy for both the funders as well as the networks. And that's what ultimately gives a better output in terms of the end goals for us. For example, SDG 3. Network, next slide, please, Amanda. Now let us look at some of the challenges. Challenges are everywhere. Do we have challenges only in LIC or LMIC? No, there are challenges in HIC also. Different challenges at different places. Is money a challenge? Money is a challenge everywhere. But yes, there are some challenges which are often quoted. Scarcity of opportunities, human resources, literature, etc., a lot of things. But one of the challenges which we as LMIC or LIC have to understand and act upon that is our hesitation in data sharing. And why does that happen? It happens because of multiple reasons. But yes, that is there. It is not only availability of data set, it is the availability of reliable data sets. And that reliability comes from bringing out the fear that we have of sharing the data, which will help us to create good quality data. Lack of crosstalk between the programs, policy, researchers, and within the network partners. I think if that is achieved, we are going to overcome a lot of challenges. Can we go to the next challenges, please? Yes. Let us look at how funders look at it when they have to work with the LMICs. There are a lot of challenges. It is not to play the blame game. I'm not playing any blame game. I'm just saying that these are the challenges which funders often bring us up when they talk to us, when they interact with us. But English directly proportional to authorship. This is what I personally have experienced and felt that in the LMICs, why should a language be a barrier? Why can't we have scientific publications in other languages? Why only the impact factor is so important for only the English language journals? Why is that important? And why everything can be done only in English? I think this is something we have to think of very seriously. Buying data versus co-generating data. That's where the networking comes in. You just create data and then share it with the collaborators elsewhere. Is that the way we want to way forward for LMICs? Definitely not. I think the best way is we work together to generate data and work on the data and use the data. Funding availability for paper writing and dissemination is never available. You see, you end the study and you say that, okay, the study is over. What do? You write the papers, but where is the money? Nowadays, there is a change. I think a lot of funders have realized, the collaborators have realized, and I'm not talking about the collaborators from the West or the high-income countries. I'm saying collaborators within the LMICs also, or the funders within the LMICs also function in that way. Can we go to the next slide, please? Now, let us look at some of the challenges spent. And this slide I want to highlight specifically because, you can see the maximum publications coming from the high-income countries. Why? I have seen, at least in the 5-6 countries which I very closely even today work in the Southeast Asian region, we spend most of our time in writing proposals, planning, data collection, or on the field trying to get resolution during the data collection and the data quality, etc. Do we really spend enough time on paper writing or proposal writing? I think we seldom use that, right? Because entire study, if you look at a 5-year funding or a 5-year collaboration, 4.5 years or maybe 4 and just last 1 or 2 months are for report writing and dissemination. Is it really feasible and possible? The writing starts after that. The entire time of the LMIC researchers goes in the planning data collection. I think there must be enough time. And it's not that you cannot write during the study, but there are limitations. You know what are the limitations. Every one of you are researchers. You know it very well. Can we go to the next slide, please? Another challenge is about the stakeholder engagement. You look at any proposal funded by any institution, a lot of stakeholder engagement nowadays is talked about, and investment is there in it, but to what level? From the beginning of the study to the end of the study. That's the end of it. Who funds the stakeholder engagement after that, when the real findings of the study could be taken to the stakeholder? Who funds that? Who needs it? Need is for the LMICs, where the research is happening. To whom do we work with? Is the local stakeholders. How do we do? When do we do? Do we do it before the study? No, we cannot. Before the study is only to get them involved in a research to get the data that we desire. After that is what they could benefit from the research, which we do not have funding for. I think every research must ensure that post-documented end date of the study, there must be enough funding available with the LMICs for real stakeholder engagement. Next slide, please. Yes, another learning. Best practices are really, really crucial. Can we go to the next slide, which tells us how really, if we work together, next slide, please. How, if we really work together, LMICs and HICs, sorry, the slide before this. Yes, the research fairness, research integrity. These are the two topmost things which are very important if you have to generate good quality data with ethical research. These are these BREACH guidelines which were developed by the North-based HIC institutions and the LMIC institution in Asia and Latin America together. And these guidelines, if you look at these guidelines, going to the depth of these guidelines, these really bring up the quality of the data. And if this really are implemented, I think that's the way forward for best practices for generating good quality data. Can we go to the next slide? Next slide. Amanda. Yes, thank you, Amanda. So some of these practices, best practices could be, are written like good rapport with the community, because these are cohorts, because these are longitudinal studies, good quality, exchange of information time to time and not only once at the end of the study. Return of analyzed information from wherever you analyze, whether you analyze here or with the collaborators, you need to return it to the community. And that should be on top of your mind all the time. Engaging the community, long-term plans for working with the community, even after the findings are available of the studies, honesty with the community, especially when we are going to the community for collection of data, long-term, and ethical conduct of the study. Next slide, please. Next slide, please. One important learning is collaborations are 80% communications and just 20% science. I think this should reverse. We should have more science, because you look at these are some examples I've given, but I think this is important to keep in mind. Next slide, please. I'm going to be a little fast now. I know I'm running out of time. This is a classic example, the HDSS network of the in-depth network in Africa and Asia. So this was a wonderful network, and it is struggling today. Why is it struggling? It is simply the communication. Long-term communication doesn't happen. We don't want that to happen with the Asian network and the recently established network in Africa and India. Can we go to the next slide? Next slide. Yes, there's just one quick example. Very recently, we have done a study by networking about 20 institutes in India. And because this is microbiome related, genomics related conference, that's why I'm just giving the example, where 3,000 samples are collected across the nation for 2 time points. And we are going to collect it even further for genomic studies as well. So these kind of studies are possible only when there is solidarity between the network partners. Next slide, please. Next slide, please. Sharing is something very crucial, and my next speaker, my senior colleague, Dr. Cobus Herbst, is going to tell more about this kind of approaches, but sharing is something which we have learned is very important. Next slide, please. Next slide. Yes. So we worked with the in-depth network by creating the in-depth sharing and access repository. This work was about 5-year work. And when it resulted into a good repository, what it yielded, next slide will tell. Next slide, please. We have people from all over the world using this. And because these are our own data of LMIC shared globally, more people from LMICs are using it. It just says that if you give them time and opportunity, LMICs will also work. Next slide, please. Next slide. Equity really, really matters. Is this last learning from my side? Equity really matters. Where I feel more focus should be on the publication, more focus should not be on publication alone, but beyond that. Commercialization is something which should be kept away. And currently that is what is happening. You say it is, what is it known as nowadays? The open access, but everything is as good as commercialized. You have so many journals coming up just because they want to publish. Is it that they want to share the knowledge? I really doubt that. Let's focus on more important things like capacity building, timing, training, community engagement. This should be really focused more. Misuse of language skills is another thing which we need to keep in mind all the time. And we should encourage the LMICs, irrespective of their language poverty in this language control. I think that should be kept in mind. Sponsor funder versus everywhere you see, I have seen many places, the sponsor funders dictate whether anything is published or not. Why is that needed? This is the data collected in LMICs. Why can't LMICs publish it without asking these funders and sponsors? I think that is a big mistake every funder and sponsor is doing. And they could, as long as LMICs do that responsibly, and are we fools not to understand what should be published and what should not be published? I think we are not that fools. We could do that, and we could do that very responsibly. We need to show that we could do it, and then our funders, our sponsors, our collaborators would be more than happy to support us there. Co-creation versus one-way communication, that is something we need to keep in mind. But yes, access to research data should be given much more priority than just the impact factors. Next slide, please. Next, just the last couple of slides for me, I believe. Next slide. Amanda? Amanda, next slide. Yes, good. Okay, I'll just skip this slide, but this is just an example to show how we work together. But what is more important is organized efforts and good governance can give answers to all. Who does, who funds, who decides, who uses work. Next slide, please. Next slide, Amanda. These are two good things. And I think Zafar Chaudhary's work with the Ganashastra Kendra in Bangladesh and Amul by the Korean, if business could be done cooperatively, why can't the biobanks, why can't the data repository work in a cooperative manner? I think I'm not saying commercialize it, but we could work as cooperatives. I think this is a way forward we should really think very seriously, especially for biobank more than for the data repositories. Next slide, please. Next slide, please. Amanda? Yes, that's it from me. Thank you very much for the patient listening. Thank you very much, Michelle, Amanda, and everyone. Thank you very much.
Thank you so much, Sanjay. That's been an incredible sort of learning experience, I think, for all of us, for you taking us through those 7 learning points. And, you know, I'm so aware of the challenges that we face in low resource settings. And you write that together we are stronger. I think there are real barriers like, you know, also legal systems, which sometimes don't allow sharing in the same way. So I think, you know, there's so much that we have to navigate when we work across borders. But I certainly agree that that it is a necessity if we want to look at global problems. We have to find ways of doing this. And I think the last 2 days we heard some really creative sort of initiatives about federated data analysis and so on. Congratulations on forming the Asian group of HDSSs. I think that is incredible, and really looking forward to seeing what's happening there, and really hope that the in-depth network too will stand up again and connect us across the different continents, Latin America, Africa, and Asia, because I think there's so much that we can do. So I'm not sure if there are any questions. I don't see any in the chat. So our time is up. So just again, Sanjay, thank you so much for sharing your wisdom about the challenges and how to overcome them and giving us hope for the future.
Thank you, Michelle, and thank you, everybody.